guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering nutrition. This is actually part 2. I did another video on nutrition last week, so if you haven't seen part 1 already, please be sure to do so. Also, guys, don't forget, please like and subscribe below. If there's any videos or any content that you'd like to see me cover, be sure to go ahead and put in the comment section and I'll make sure I make a video for you. So part 2 of nutrition, let's get started. First question. A client's been receiving 2 feedings and is tolerating them very well. The healthcare provider determines that the rate of the intermittent 2 feedings may be advanced. The nurse prepares to 1, increase the feedings by 50 milliliters per day. 2, start an isotonic formula at half strength. 3, infuse a bolus feeding over 5 to 10 minutes. Or 4, begin feeding with 250 to 500 mLs at each interval. And I'll give you a moment to think of your answer. So guys, the correct answer is 1, increase feedings by 50 mLs per day. So with these intermittent 2 feedings, you know, when the patient gets started off, they're usually started at 40 to 60 mLs per day. Once that doctor or the nurse practitioner decides that that patient's ready to be advanced, that's really where you want to be. You want to increase it by 50 milliliters per day. Let's go over the other choices. Choice 2, start an isotonic formula at half strength. There's no need. You can start at full strength. The question is, the question here that they're asking about is how to advance the 2 feedings. Choice 3, infuse a bolus feeding over 5 to 10 minutes. That's too short, guys. That's too short. That's too much going into the patient too fast. You want to know what's going to happen? That patient's going to start cramping up. They're going to start sweating. They're going to start feeling nauseous. Okay, so you really want to do it over 20 to 30 minutes. Okay, so that's why number 3 is wrong. And choice number 4, begin feedings with 250 to 500 mLs at each interval. That's too much. So each interval, you really want to do 150 to 250, no more than that. So that's why number 1 is the correct answer. You want to increase the feedings by 50 mLs per day. Next question. The nurse is aware that there are many medications. The nurse is aware that there are medications that are taken that after the client's taste may influence the dietary intake. In reviewing the medications taken by the clients on the unit, the nurse will consult with the nutritionist to develop a palatable meal plan for the client taking 1, ampicillin, 2, morphine, 3, furosemide, or 4, acetaminophen. And the correct answer, guys, are you ready? The correct answer is number 1, ampicillin, which is penicillin. What it does is a lot of times it changes the taste. And so many patients, because that taste that it gives them, that they really can't taste the food normally, they won't want to eat. Okay, ampicillin does have that side effect on some patients, not everybody. Let's look at the other choices. 1, morphine. No. What morphine does, you guys know what morphine is, an analgesic. It's a narcotic, slows things down. Morphine can cause constipation. It really doesn't change your taste buds. Furosemide. You guys, you know furosemide is a diuretic. What that does, a side effect of it is that it can decrease the absorption of food. So when patients taking diuretics, you don't want to take your diuretics at the same time that you take the food, because what diuretics can do, such as Lasix, it decreases the absorption, okay? Not of the drug, of the food. Opposite. It decreases the absorption of the drug. Because let me explain to you what happens very quickly. I'm getting off topic, but just so you know, what happens is they're both fighting for receptor sites and food wins. So what happens is that drug that you're taking, which is the Lasix, it doesn't get absorbed the way it's supposed to. That's why. So anyway, choice number 4, acetaminophen, okay? What does that do? It's hard on the liver. You guys know acetaminophen, that's Tylenol. You can give it for fever. Some patients take it for headache. But an effect that it does is it affects the liver. So if a patient's taking a lot of acetaminophen, you better be looking at those liver enzymes. So anyway, back to the answer. The med that can change the taste is number 1, ampicillin. Next question. Food safety is a concern of a group of adults attending the community health clinic. The participants identify to the nurse that they have seen a lot of reports on television about E. coli. I'm not going to try to say that word. I'm going to mess it up. So it's E. coli. And how dangerous it can be. When asked where the bacteria comes from, the nurse responds that a potential source of E. coli is 1, sausage, 2, soft cheeses, 3, milk products, and 4, ground beef. And I'll give you a moment to think of your answer. The correct answer, guys, is 4, ground beef. Undercooked meat like hamburger, rare or medium rare, if that meat is not cooked, it can cause E. coli. Okay, so I want to go over the other choices and why they're wrong. Number 1, sausage. Sausage is actually a source for that would be sausage. Botulism. So let me explain to you, how can you get botulism from things that are canned, like canned meats, canned fruits. Okay, so for sausage is botulism. 2, soft cheeses. Soft cheeses, you can get, it's a bacteria, and I'm going to mess up the name, listeriosis. No, I said it right. So soft cheeses, you can get listeriosis from it. Milk products, shigellosis. All right. So number 4 is the correct answer when it comes to ground beef. And not when it comes to E. coli, not only ground beef, any meat that's undercooked, you can get E. coli from. Another source that you can get E. coli from, obviously, guys, stool, feces. So what happens is, if you have workers in a restaurant, they go have a bowel movement, they don't wash their hands, they have some of that stool underneath their fingernails, and then they go cook, and some of that feces gets in your food, you can get E. coli as well. E. coli is found in the stool, okay? The nurse recognizes which of the following clients is being at greatest risk for a negative nitrogen balance. 1, a 10-year-old with an infected laceration on the left thumb. 2, a 75-year-old who fell and experienced a mild concussion. 3, a 40-year-old who has partial thickness burns over 15% of his body. Or 4, a 19-year-old who has lost 70 pounds in 7 months as a result of dieting. And I'll give you a moment to think of your answer. Okay, guys, so the correct answer is 4, a 40-year-old who has partial thickness burns over 15% of his body. So let me say this to you, because this is how they try to trick you with these other choices. How can you get decreased nitrogen to the point that you don't have enough for your body? Infection, burns, trauma, especially trauma to the head injury, fever. So look how they try to trick you. Number 1, they said a 10-year-old with an infected laceration on the left thumb. So what they wanted you to do was think, oh my gosh, infection. When you get infection, your nitrogen goes down. It has to be that. But the infection's where? On the thumb. It's a tiny little place, right? It's not all over their body. 2, a 75-year-old who fell and experienced a mild concussion. Oh my gosh, concussion, head trauma. Oh, that's nitrogen. But look what it said. It said mild concussion. So as a student, when I saw that, if I saw that, I would have held that onto that as a choice. Okay, I'd be like, okay, maybe possibly, right? Because a mild concussion in the head, that's way worse than the little infection on the finger. Then we have choice 4. A 19-year-old who lost 70 pounds in 7 months as a result of dieting. That's losing a lot of weight, but like I said, losing weight, that's not one of those risk factors for you to have decreased nitrogen excessively. It has to be like burns, fever, infection, trauma, like severe trauma, head trauma. So number 3 is the answer, because look at that. They have burns over what? 15% of their body. Okay, so by far, this is going to be the correct answer. That patient is most at risk for having a negative nitrogen imbalance. And let me go a step further. Don't forget what I told you guys about in my video that I did burns. What is one of the biggest concerns when we have a patient with burns? Infection, right? So that's a double whammy. So number 3 is the correct answer. Next question. The nurse is discussing food selection with a client who recently experienced a partial thickness burn over 20% of her body. The client expresses a reluctance to ingest a large amount of carbs because she successfully lost 50 pounds and does not want to regain the weight. The most therapeutic response to the client's nutritional needs is 1, don't be concerned about regaining the weight until your burns have healed. 2, you need a huge amount of calories to heal, so there won't be a weight gain. 3, you will experience a nitrogen imbalance if there aren't enough carbs in your diet. 4, the extra carbs will be utilized for energy so that your protein can be saved to repair your skin. And this was a long question with a long choices, so I'll give you a moment to think of what you think the answer is. Okay, guys, so if you chose 4, that's the correct answer. And let me tell you why. Not only, you see 4, the extra carbs will be utilized for energy. That part addresses the woman's concerns about gaining weight. You're letting them know that those carbs that they're going to be eating, it's not carbs that's just going to make them fat. No, that carb is going to be giving them energy for what? Wound healing. And then it goes a step further. It says, so that your protein... What do we use protein for? What is protein good for? Wound healing, so that your protein can be saved for repair of your skin. You see choices 1, 2, and 3? They do not address why the carb is important for their body. All they address is the patient's concern about losing weight. And some of those choices aren't even correct. So this is why number 4 is the correct answer. It addresses the patient's concern about losing weight, and it explains to the person why it's important for that patient to get the carbs, okay? Next question. The nurse and the mother of an infant are discussing the introduction of solid foods into her child's diet. Which of the following statements made by the mother reflects the best understanding of the most appropriate manner to introduce new foods? 1, both my husband and I have allergies, so I'm very cautious about introducing anything new into her diet. 2, I'm a fussy eater, and so are my other children, but I will offer her a variety of foods so she will have a good appetite. 3, I'll start with non-wheat cereal and then vegetables, 1 new food a week so I can see if something doesn't agree with her. 4, my other children just loved solids and really were a joy to feed. I expect she will be as receptive to new foods as they were. And I'll give you a moment to think of your answer. So guys, the correct answer is 3. The correct answer is the only one that actually addresses how mom plans to introduce new foods. That's the only one. None of these other choices answer the question, because the question is asking which one explains how introducing new foods will be done correctly. And number 3 is the only answer. So yes, you want to start with non-wheat cereal, just in case, because lots of people have allergies, especially children. One of those allergies happen to be wheat. So you want to do non-wheat cereal. So you're going to start with the non-wheat cereal and then the vegetables. And then what you're going to do, each vegetable that you introduce, You're going to introduce one vegetable a week so that if the patient has some kind of allergic reaction, we can know what it was, because that's the only new thing we introduced in the diet. Let me take it a step further and tell you guys something else, because I see lots of, sorry guys, my camera's acting crazy. I've seen lots of test questions on that in regards to peds and food. Introducing new foods, you want to save the fruits for last, close to last. Here's why. If you introduce foods first, that child is not going to want to eat the vegetables at all. Okay? So what you want to do is introduce vegetables first, get that child accustomed to vegetables. They like vegetables because that's all they know. And then slowly introduce fruits. Otherwise, you give them fruits first, that's it. They're not going to want to eat their vegetables. A 25-month-old is discussing her concerns regarding her daughter's eating habits with the nurse. The most therapeutic response to the mother's statement, "She's a fussy eater. It seems that she will only eat dry cereal and cheese," is 1. As long as she's eating a little from all the food groups and getting enough fluids, she'll be all right. 2. Her weight and height are right on target, so she must be getting what she needs to grow and develop. 3. Don't expect her to start liking a variety of foods for several more months. Just keep offering her what she likes. 4. It's very common for toddlers to be picky eaters. Try offering her foods frequently and offer high nutrient density snacks such as the cheeses she likes. And I'll give you a moment to think of your answer. And the correct answer is 4. It's very common for toddlers to be picky eaters. Try offering her food frequently and offer high nutrient density snacks such as cheeses she likes. So let me explain this to you guys. Toddlers, ages 1 to 3, right? This is now where they're walking, they're exploring, they're learning about their environment, okay? This is also a time where they learn to say no. Everything you want, everything you offer to them. No, no, no. They say no to everything. Why? They're establishing their independence. Okay? And this is around the age that they're picky eaters. That is a milestone for the toddlers around 1 to 3. So what you want to do is just keep offering them meals, but you want meals that are nutrient dense. You don't want to just give them meals that are empty carbs, because remember, they're toddlers, they're exploring their environment. What are they doing? They're running. They're all over the place. They don't want to stop. They don't want to stop. They're going. So you have to give them what? Finger foods. Give them finger foods that when they're going, you kind of treat them like a bipolar manic patient, okay? You treat them like that. You give them finger foods because they don't want to stop. So while they're going, they can have something in their hand that they're eating that is full of nutrients. And of course, on my last video, I talked to you about choking, so we don't want to give them anything on that list that's would put them at risk of choking, because what? They're going, okay? Next question. Which of the following statements by an older adult shows the most need for follow-up regarding the risk for dehydration in this group? 1. I have a glass of water with each meal and whenever I'm thirsty. 2. As long as I drink whenever I'm thirsty, I think I'll be well hydrated. 3. I try not to drink much after dinner so I don't have to get up to urinate at night. 4. I limit my coffee and tea drinking because I don't think they are particularly good for you. I'll give you a moment to think of your answer. Guys, the correct answer is 2. As long as I drink water whenever I'm thirsty, I think I'll be well hydrated. Let's go back to the question. The question asks, which needs further follow-up? Let me tell you something. When you see a question asking you what needs further follow-up, what needs more teaching, what would you question? When you see those types of phrases, what they're really asking you is what's the wrong answer? And number 2 is the right answer. Everything else is right. Number 1, I have a glass of water with each meal and whenever I'm thirsty. Good. That's right. That's correct. So we're not going to choose that because we're looking for the wrong answer. 3, I try not to drink as much after dinner so I don't have to get up to urinate at night. That's good. Remember, we're dealing with the elderly population. We don't want them getting up in the middle of the night. They're still groggy to go urinate and they fall. Okay, so that's a good answer. So we're not going to choose that. We're looking for the wrong answer. Choice number 4. I limit my coffee and tea drinking because I don't think they're particularly good for me. Good, absolutely, because tea and coffee have what in it? Caffeine. What kind of population are we dealing with? The geriatric population. We're dealing with the older population. So that's good. The only wrong answer in this group is number 2. As long as I drink whenever I'm thirsty, I think I'll be well hydrated. What did I tell you in my last video about the elderly population? About their thirst, their sense of thirst. They don't have it or severely decreased. They don't get thirsty. So guess what? If this patient only drinks when they're thirsty, they might get dehydrated until they die. They lose their sense of thirst. So when it comes to the geriatric population, you have to teach your CNA, your PCT, to remind that patient every time they go in their room to drink water. And you as a nurse, you're going to keep reminding the patient to take sips of water because why? They don't get thirsty. All right. So you have to keep reminding them, hey, Mr. Such and such, don't forget to sip on that water. The nurse is following a newly admitted client regarding his dietary history. Which of the following questions asked by the nurse is most likely to secure additional pertinent information regarding the client's statement, I think I'm allergic to peanuts? 1. What happens when you eat peanuts? 2. What makes you think you're allergic to peanuts? 3. When did you first notice the sensitivity of peanuts? 4. A peanut allergy is very serious. How do you manage to avoid them? Okay, guys, so the correct answer is 1. What happens when you eat peanuts? Why? Because the question is asking us, what question are you going to ask the patient that's going to give you the most important information in regards to their statement saying, I think I'm allergic to peanuts? Let's look at these other choices. I'm going to start from the bottom. Number 4, a peanut allergy is very serious. How do you manage to avoid them? So you did not even find out what makes that patient think that they have this allergy. You did not find out if this patient even has a peanut allergy. You didn't find that out yet. All you said to this patient, well, this is very serious. How do you avoid them? When you say that to the patient, that's not going to give you the information you need to find out if maybe they really do have a true allergic response to peanuts. Get rid of number 4. Let's go to number 3. When did you notice your sensitivity to peanuts? That question is not going to give you information that you need to find out, does this patient really have a true allergic response to peanuts? Number 2, what makes you think you're allergic to peanuts? As a student, and I saw number 2, I'd be like, this is a good one. I'm going to hold on to this because this might be my answer. So you're between number 1 and number 2. Now look at number 1. What happens when you eat peanuts? If number 1 wasn't there, number 2 would have been the answer. But because number 1 is there, that is the answer. What happens when you eat peanuts? If that patient says, oh, when I eat peanuts, I get a sour taste in my mouth. I don't feel like eating anything else. That's not an allergic response. If that patient says, when I eat peanuts, I break out into hives. When I eat peanuts, I get a rash all over my body. When I eat peanuts, my tongue starts to swell up. When I eat peanuts, I feel like my throat's swelling up. Like every time I swallow, it's very painful. I feel like I can't breathe. When I eat peanuts, I start wheezing. I can't breathe. That is a true allergic response. That's what you call an IgE mediated response, okay? A true allergic response. Why? All of those examples I just gave you, they're generalized, okay? These are systemic, okay? So that's how you find out if a patient really has an allergic response. You ask them, what happens when you eat it? And based on that patient's answer, you'll know if it's a true allergic response or not. So that's why number 1 is the correct answer. The nurse is caring for a 5-kilogram, 8-month-old infant admitted to the hospital by a healthcare provider who was concerned about the infant's low weight. The infant's birth weight was 3.5 kilograms. The nurse knows that on average, an infant doubles his or her birth weight by what age? 1, 2 to 3 months, 2, 4 to 5 months, 3, 6 to 7 months, 4, 8 to 9 months. Now, most textbooks, guys, give you just one number. This one's giving you a range. And I teach from lots of textbooks, and most of them are in agreement. I'm trying to think if I should tell you the answer or explain it. So I'll give you the answer that I explain it. So the correct answer is 4 to 5 months. And most textbooks will tell you 5 months. By 5 months, you should see the infant's weight double. And by 1 year, it should triple. Okay? So I hate that with these choices, it kind of gave you a range, but whatever, that's okay because the range still has your answer, which is your 5 months. Most textbooks agree. 4 to 5 months, the infant's weight will double. And by 1 year, you expect that weight to triple. Which of the following statements by a new mother indicates that the nurse needs to provide additional teaching before the client is discharged home with her infant? 1, I'll be using infant formula, which will provide all the nutrition that my new baby needs. 2, I can feed my new baby every 3 to 4 hours when I get home. 3, I need to sterilize all my baby's bottles and nipples to make sure they don't have any germs. 4, I can put a few drops of honey in my baby's formula to make it taste better. Okay, guys, I hope you guys chose 4. We never, ever, 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 ever give honey or corn syrup to infants, okay? Guess what that can cause? Botulism, okay? And let me tell you something. Infants, that's the age from birth to 1 year. Once they hit 1 to 3, they're now in toddler stage. But infants, where was I going with my thought? What was I going to say to you? Infants, all they need from birth to 1 year, they need their milk. So whether it's breast milk or formula, that's all they need. You don't have to add anything to it. Let me back up on that statement. Let me back up on that statement because I have to clarify something. I'm not all the way to 1 year because once they hit about 4 to 6 months, around like the 5 month, you can start introducing the rice cereal into the formula. So when I said that's all they need, I mean you don't have to give them, they can't have solids, you don't give them anything more. Really all they need from about birth to that 1 year is their formula. Or the rice cereal that you could put in the formula once they hit around that 5 month mark, okay? But never. And another thing about honey, lots of children who have allergies, they tend to have allergies to both honey and corn syrup. And when I say allergies, not just mild allergies, I mean severe allergies, the type of allergies where they have a true, like I said, IgE-mediated response that they're going to have an EpiPen with them everywhere they go. Okay, so we don't play with that. We do not introduce it. We try not to even introduce it until they're toddlers. Okay. Number 42. Oh, I'm sorry. Let me back up. Number 42. Let me back up. Let's go through these other choices. Choice 1, 2 and 3 are all correct. These are all correct. 1, I'll be using infant formula, which will provide all the nutrition that my new baby needs. That's 100% correct. You don't have to add anything. 2, I can feed my baby every 3 to 4 hours when I get home. Absolutely, because that's when they're going to want to feed. Every 3 to 4 hours, you're going to be changing those diapers. Same, because remember, the baby's so small. They're this tiny, right? So everything that comes in, it's going to come out. So that's how often you're going to be changing diapers. 3, I need to sterilize all my baby's bottles and nipples to make sure they don't have any germs, of course, because you don't want the baby to get an infection. So 1, 2, and 3 are all correct, but we were looking for the wrong answer because in the question, it said, which one needs additional teaching? Whenever you see something asking you which one needs additional teaching, which one would you clarify? Which one would you have to follow up on? Things like that, what they're really asking you is which one is the wrong answer. Next question. One easy way that parents of teenagers can ensure that they're getting enough iodine in their diets to support the increased thyroid activity during adolescence is to 1, give the child a multivitamin daily. 2, use iodized table salt. 3, keep fresh fruit and vegetables on hand for snacks. 4, serve red meat at least once a week. Now, guys, they tried to trick you because the other choices are great choices. Like, you want to do that. You want to, the correct answer is number 2, by the way. You want to give them multivitamins. That's fine. You want to make sure they have fresh fruits and vegetables. You want to make sure they have protein. But this specific question, what are they asking about? Thyroid function. Okay, so when they're asking about the thyroid function and to help with the thyroid function, the correct answer is 2, use iodized salt. Why? Because of the iodine. And here in the US, we really don't have that problem that much because our salt has iodine in it. Unless you choose a salt without it, our salt has iodine in it. But that iodine, that's why it makes number 2 the correct answer. The iodine is needed for thyroid function. Okay, guys, a last question. The nurse is counseling a 64-year-old client that it is important to eat plenty of fruits and vegetables, but the client should avoid which of the following because it can inhibit the absorption of some drugs. 1, oranges. 2, grapefruit. 3, pineapple. Or 4, asparagus. Guys, the correct answer is grapefruit. Let me tell you something. Oh my gosh, I can't tell you how many drugs that patients cannot take grapefruit with. If you ever have a pharmacology question and the patient's taking a drug and it says which food should the patient avoid, if you have no clue what the answer is and you see grapefruit, choose it. That's how many drugs that grapefruit has interactions with, bad interactions that we don't want, okay? That's contraindicated. So if you don't know what the answer is and you see grapefruit, go ahead and choose it. Because grapefruit decreases the absorption of so many drugs. I have passed my time, but there's some good concepts on here that I see on test questions all the time that I want you guys to know, so I'm gonna go ahead and keep going. Next question, when menu planning for a newly diagnosed diabetic client who practices Judaism, the nurse should avoid which of the following dishes? 1, vegetable beef soup. 2, chicken pot pie. 3, beef lasagna. Or 4, scrambled eggs. And the correct answer, guys, is, oh, where's my question? The correct answer is beef lasagna. Why? Because in the Jewish culture, they do not, religion, they do not eat meat with dairy products. And of course, lasagna has the ground beef and the cheese, right? So that's why that's the correct answer. Last question. The nurse is caring for a 55-year-old male client who knows that Due to his religious beliefs, he's most likely a vegetarian. Which of the following religions encourage a vegetarianism? 1. Church of Jesus Christ of Latter-day Saints. 2. Seventh-day Adventists. 3. Judaism. 4. Pentecostal. And the correct answer, guys, is 2. Seventh-day Adventists, okay? That religion, they actually encourage plant-based diet. And another question I've seen many times appear on tests in foundations for culture. And I've seen this pop up on NCLEX as well, and ATI, HESI. So something else you need to know about the Seventh-day Adventists, no shellfish. They don't eat lobster, crabs, shellfish, they don't eat, okay? So guys, I hope this video was helpful. Like I said, if you didn't watch part 1 on the nutrition, please watch it because there's so many important concepts on there. And as I said in my first video, I promise you guys, I've been doing this for years. I'm not going to age myself, but these questions that I choose are questions that I've seen pop up on exams, on NCLEX, on ATI, on HESI, on midterms, quiz, finals. They come up over and over and over. They are very important concepts for you to know. So if I'm talking about it, that means you need to know it. So whenever I do a video and I cover a concept that you never heard about it or you're not familiar with it, go look it up. Go into your textbook and look it up because I promise you, you're going to see it again somewhere. I hope you guys enjoyed this video. Please, guys, please don't forget to like the video. Don't forget to subscribe so that every time I make a video, you can get a notification. And if you have any friends that are in the nursing program that you know that these videos would be helpful to them, share it. Share it, guys. Okay, I'll see you next time. Bye.